Hello, Dr. Albert.
Dr. Zhang, good to see you.
Yes, and it's getting so hot during the summer in Florida, and I think some people started having like a different kind of headache. So to prevent headache, what is your suggestion, and what's the common reason causing headache?
Yeah, I think there are a lot of different types of headaches, right?
Yes.
So I think now we're seeing a lot of pollen out there and people are having
Yes.
allergy symptoms. And so they get this congestion, and the pressure kind of in the front of their sinuses, and that
Yes.
can cause headaches sometimes.
Yes, yes.
So I think that's one
One
potential cause.
Yes.
Typically, we have medicine that can affect the size of the blood vessels. So usually if the blood vessels in the head dilate too much or expand too much, then people get headaches or migraines. And so some of the medicines like sumatriptan or Imitrex work by constricting those blood vessels.
Yes.
And taking away that pain that people are getting.
That's usually a pressure headache, right?
A pressure or a migraine,
right?
Okay. So a migraine can be a headache that could last for hours to days, and people have sensitivity sometimes to light and sound with migraines. I think that a lot of migraines and other types of headaches are triggered by certain things people are eating or certain exposure to different chemicals in the environment. So their MSG, for example, monosodium glutamate, or nitrates in foods, which are preservatives used in a lot of foods, especially deli meats, is known to be like a big cause of headaches or trigger for migraines for people.
So the other thing I was thinking, the other factor could be when the blood vessel has inflammation, then it will be more sensitive to temperature changes or to the stress, and even like neck tension can irritates the head and put pressure on the nerve, so can irritate the nerve.
Right. So there's occipital neuralgia, where people have compression of the occipital nerve, in the back of the head, causing a headache kind of up here. Yeah. And there's a tension headache, which is kind of like a band squeezing around, tightening around the head. And that's from tension in the neck muscles back here, from people kind of sitting and working on their computers all day or reading all day, right?
Yes.
And not really opening up their, posture.
Yes. So stretching, exercise. Then the other thing I observed is when people drink a lot of coffee, they tend to get a headache. But if you don't drink regularly, if you do have a headache sometimes, then the coffee really helps them, right?
Yeah, caffeine is a tricky one,
Yes.
Caffeine and chocolate can help also with headaches, but sometimes if you have too much, it can cause the opposite effect.
Yes.
And caffeine, a lot of people drink coffee, so that complicates things when people are dealing with headaches, with trying to figure out what's the cause.
Yes, yes. But my impression, I observed people who don't drink coffee regularly, and they have less frequent and less intense. And if they do drink like more than 1 cup every day, then they tend to have more, because they are just sensitizing their nerves, and it create the tension in the muscle. And generally, you don't drink coffee, right?
No, I don't.
Yeah, I don't drink coffee regularly. So I think the neck and shoulder muscle are more relaxed than people who drink more than 1 cup. So that's another thing about caffeine. I think if people get more frequent headache recently, I think they really should consider substitute with tea, because most green tea and black tea, they don't constrict the blood vessel. They kind of relax the muscle and dilate the blood vessel. So,
and it's lower in caffeine.
Yes.
A lot of people are having espressos. They're very highly concentrated caffeinated beverages, right?
Yes. The other possible cause is you mentioned the allergies, and dehydration is another big thing.
Right.
So if people are really dehydrated, and then their blood pressure started going down, then that could also,
Right. High or low blood pressure can cause headaches. And
yes,
same thing with low blood sugar too, right?
oh,
Can cause
yes,
headaches for some
yes.
people.
How do you differentiate high blood pressure headache and low blood pressure headache?
Well, I mean, I think it can be hard. Typically high blood pressure people can hear like a pounding sensation in their ears, right?
Yes,
Or feel
yeah,
a pulsating in their head.
yes,
But with low blood pressure, you don't really get that. You feel more weak, fatigued, right,
yes,
tired.
yes,
Especially if you stand up from sitting, people can get lightheaded and feel like they're about to pass out. But that's something that should really be evaluated. Why is your blood pressure low? Because that can be very dangerous, or high,
yes.
right?
So optimize the blood pressure is
Right.
another way. And also people who tend to drink more than one glass of wine or other alcohol, they really create some kind of blood vessel inflammation. And that inflammation making them more prone to headache, right?
Right. And there's different types of inflammation that can cause headaches too.
Yeah.
So I very rarely get headaches, but if I do, it could be something related to histamine overactivation for me and my
Yes.
digestion. So there are certain herbs and supplements I can take to counteract that
The
and stop
histamine.
that histamine
Okay.
process before it spirals and becomes very inflammatory.
Exactly. The histamine also cause the blood vessel leaking, right?
Hmm.
It's like increase the permeability. So
Right.
when you have that leaking, it can irritate the nerve, and also cause different kind of skin issue, right?
Right. And I think a lot of diseases, can be caused partly by issues with the microcirculation and with increased permeability and leakage of those vessels at the capillaries or with the microcirculatory system. So,
To reduce or optimize the histamine level, you have any herbs or I mentioned that Fang Feng Tong Sheng, right? Yes, I use that for myself when I have hives, and I recommend recently to a couple of ladies who had eczema after they delivered a baby, and they really like that herbs, and that's definitely clearing the heat and reduce the inflammation. I used to take that first in the morning when I feel itchy. I take that, and then itchy sensation will go away. Any other herb you
yeah, I
think?
think from Western medicine perspective, chamomile can help stabilize mast cells and prevent them from releasing so much histamine, and it helps calm down the digestive tract. So I've been taking it for over a decade every day.
When did you take chamomile?
I usually take it in the evening time,
In the
but
evening.
I've
Okay.
taken it, all throughout the day. It's very safe. And
Okay.
another one is spirulina. Spirulina helps
Uh-huh.
stabilize mast cells and can be more effective than some of your over-the-counter allergy medications, even.
Spirulina, is that a tea form?
I use the capsules.
The
of
capsules.
spirulina.
Okay. Do you regularly take that, or only if you sense that your histamine level is going up, you may get a headache or you may get some allergy symptoms?
Right. I think for me, I regularly take it just because of my microbiome. So different people have predispositions to more histamine production like I do because of a microbiome change. So you
Okay.
can do genetic testing of your microbiome like I did over a decade
Okay.
ago and get that
So when you
information.
test that, the microbiome, what kind of microbiome, what kind of a test
Bacterial.
result indicate that?
So you can see which types of bacterial species are more prevalent than
Okay.
others and compared to like a healthy population or cohort.
Okay, okay. So that's if you tested your microbiome make you prone to have higher level of histamine.
Right.
Then
Maybe you don't
take,
degrade the histamine as well, and you can take
okay,
diamine oxidase
okay,
or other things, or you maybe produce more because the regulation of the immune system is not being conducted in the most optimal way based on the
yes,
signals being produced by the microbiome.
yes.
And there's other herbs too, like butterbur can help with allergies. That's another Western herb. And feverfew can help with migraines if it's actually like a migraine, and more helps with the blood vessel issue.
So the headache could be constriction of blood vessel or
Or dilation.
dilation. So to differentiate. Let's say we make a diagnosis that it's a dilation of blood vessel, and then you target the herbs, or with one kind of herbs, or it's constriction, you use another kind of herb.
Could be, but I think it's more complicated than that, right? Because we have to figure out why is the blood vessel changing in size in the first place, and how can we prevent that from even starting to happen.
Okay.
Right?
So in Chinese medicine, when I give herbs to treat either headache or other condition, high histamine, then I look at their tongue and take their pulse, and then I'll put different herbs together, targeting the digestive system, and some herbs can, dilate the blood vessel, and some herbs can help, constrict the blood vessel. So that's our way to prescribe a group of herbs to target different organs. For the acupuncture, I think targeting the tight muscle is one, and then most points are kind of relaxation points. But then that brings up a dry needling technique, which I don't know you ever tried dry needling, because that is part of the acupuncture, but they emphasize the painful area, like you have shoulder pain. Then they're going to put so many needles in this area and try to stimulate. So my impression is, if you stimulate one area with so many needles, or with such strong stimulation, you actually dilate the blood vessel to the point that, people can get some kind of a increased histamine localized,
right.
And then they can also have some temporary rashes, and
right.
And the other thing is, I'll do the facial rejuvenation to help the facial muscle drooping, and when I do the needle on the face, it dilates the blood vessel. So people who tend to have frequent headache, I have to put needles balanced, like feet and hands, so that it won't just dilate the blood vessel in one area. So that's my approach to headache. But do you think that the prevention of using like certain medication, even they don't have the headache, there's a preventative medication? Do you think that's really making sense?
Well, I mean, it's not treating the root cause in general, right, of the issue. So I think you always want to try to figure out what's the cause. In most cases, I think it's dietary, or it could be allergies, or it's muscular, right, from neck tension. So, and that can be treated with physical therapy. So, or acupuncture. So I think that you have to really address that cause. I've had several cases in the past few months of headaches, and I've been able to treat them, mostly through digestive, teaching. So don't have foods that are high in preservatives, right, or very processed foods that have all these chemicals in them that can really upset the microbiome and probably change your neurotransmitter levels, which I think in turn will affect the blood vessel size, right?
So that's very important too. But I just don't quite understand. Like, for instance, if I use herbs to treat certain problems, and I will target the root cause, and then once they get better, I will ask them to stop that, because herbs are herbs, right? Herbs are not food. Right. You just don't want to take that forever. And the same rule to the medication. The medication is effective, but if you take that all the time, you have to up the dosage, right?
Right, and because it's not balanced necessarily, so you're going too far down one pathway potentially, right? To try to overcompensate for an underlying issue that you don't actually address, right? So it's important to try to figure out what's the actual cause and address the lifestyle changes and environmental changes that you can to be able to do it. And that's why people have to do acupuncture in multiple sessions too, right?
Yes, to restore the balance of the muscles, blood vessel.
Right, because people could have headaches even from a virus.
Yes.
Right, I mean, people with COVID, they had headaches.
Yes.
A lot of people, and that because the viral load is very high in the brain.
Yeah,
So
the toxin.
yeah, in those cases, it's, you know, you really just have to stimulate the immune system to do its job better, right? Get more rest and
Yeah.
recover, right?
Yeah. Thank you.
Yeah, thank you.